All right, we're going to begin by starting to talk about body temperature. I'll let you review on your own in the textbook the different terms and terminologies, but let's begin our presentation here with talking about contributing factors. And you'll notice that the Kosher book is kind of set up the same way in all your chapters. There'll always be a brief anatomy and physiology review, and then Kosher will also have a discussion about contributing factors, whatever the topic is. So sure enough, here for body temperature, there is a part in your book about contributing factors. So let's talk about some of these, and of course some of these you'll be reading on your own. So when it comes to body temperature, some of the contributing factors that you see listed in front of you have to do with the patient's basic health status and the presence of disease. There are certain disease conditions that can affect the body temperature, and one you may not have thought of is thyroid disease. Just as an example, when your thyroid is not functioning properly and maybe you have a condition known as hypothyroidism, everything slows down. And so it's very common for someone with this condition to have a lower body temperature. On the reverse situation, maybe your patient has an infection, the flu, or even something as simple as a common cold. The patient may experience a fever as a result. So these are examples of a disease that can affect body temperature. Your book also talks about diurnal variation. So throughout the day, there are different times of the day where the body temperature naturally rises and then also is quite low. And I think your book talks about how, especially in women, we can use this to our advantage and determine when a woman is ovulating or not. Your book also mentions hormones and stress. Again, hormones, female hormones can affect body temperature, but also stressful situations are another example. Stress can raise your body temperature. So whenever we're obtaining a temperature on a patient, you might want to take these sorts of things into consideration. Another thing that your book mentions is age, and especially in little children and newborns. The neurological system is the least developed body system of all the body systems when we are born, and so the neurological system plays a role in regulating our body temperature, and that's why little babies have such a hard time staying warm. They lose heat much more rapidly, and so that's why we end up putting them under a body warmer when they're brand new. And then similarly, as we age, we have less subcutaneous fat, and you know how fat keeps you warm, right? So older people also tend to suffer from the cold more so than people of other age groups. It should be no surprise to you that exercise and exertion will raise your body temperature, and then similarly the environment that you're in. So of course, being in Wisconsin, our body temperatures may be a bit lower when we're out and about in the cold. And then if you ever sign up for a hot yoga class, you'll know that yoga rooms are heated up to 105 degrees Fahrenheit, so it would be no surprise to you that your body temperature will rise as a result. All I want to say here is that normal body temperature, I want you to refer to your book for this part. And just remember that a body temperature reflects a balance between heat production and heat loss. And body temperature is regulated through sensors in our core and also on our skin, and also regulated in our hypothalamus. There are some terms that you need to review in your book, so I'll let you do that on your own. We will be using these terms in the coming weeks as we do some worksheets together, and you'll also be using these terms when you go to clinical, so make sure that you understand their meaning. When we sit down together in our small group activities, we'll talk about some of the advantages and disadvantages of each of these methods. So just be prepared for that. We'll probably do that this coming week. When it comes to thinking about obtaining a patient's temperature, there are a few things that you probably want to consider. Of course, you want to tailor your approach to the age of the client as well as their ability to cooperate. So, for example, a little newborn baby would not be able to cooperate with an oral temperature. Infants cannot cooperate or follow commands, and they're also obligatory nose breathers, so they have to breathe through their nose, and they don't understand that they need to close their mouth for an oral temperature. Also, if you have a patient who's lethargic, comatose, sleeping, these are all things that you need to consider when you're obtaining a body temperature. A couple of things to consider with oral temperatures. We tend to avoid them in children younger than 6 years. Also, if your patient is unconscious, has had any surgery to the face, neck, nose, or mouth. Also, if they have any mouth sores, you want to avoid that route. Also, if your patient is receiving oxygen and they're really dependent on it, you might not want to use that approach. Also, if they have a nasogastric tube or an oral gastric tube, you don't want to interfere with that at all. And again, you don't want to take an oral temperature on a patient who is delirious, restless, confused, or disoriented. Okay, so try to use a different route in those situations. And then as far as rectal temperatures, we don't want to use that route when a patient has diarrhea, a rectal disorder or injury, had rectal surgery, is confused or agitated, and also a patient with heart disease, which might be a surprise to you. But we have found that rectal temperatures are dangerous for persons with heart disease. The thermometer can stimulate the vagus nerve in the rectum, and this nerve also affects the heart. So you could stimulate the vagus nerve, which in turn can slow the heart rate to dangerously low levels. So be very careful about rectal temperatures. And I'll just say another word about tympanic temperatures. The tympanic membrane site has fewer bacteria than the mouth or the rectum, so the risk of spreading of infection is reduced, but you do not want to use the tympanic route if you have a patient with an ear disorder or drainage from the ear, or if the person has an active ear infection, because of course you don't want to hurt the patient. So those are just a few comments I have about body temperature. And again, we'll discuss these in more detail when we sit down in our small group discussions, and we'll actually practice the different routes on each other.